Hello, today is Thursday, December 7th, 2017. My name is Astrid Rivera, and today I would like to give you a presentation about appendicitis. First, I'd like to start off by talking a little bit about the digestive system, or the GI tract. So, on this system, there's actually two types of digestion. It is the mechanical and chemical. The mechanical digestion actually begins in the oral cavity, which is our mouths. So what happens in this digestion or breakdown, what happens is we chew the foods using muscles as well as our teeth to make the food into smaller proportions, so that once it reaches our stomach, which is the chemical digestion part of it, will actually be easier to mix with gastric juices and other enzymes in order to make the digestion easier, and it will be easier to extract nutrients, carbohydrates, as well as proteins. I would also like to inform you that the digestive system is also known as the gastrointestinal system. In this system, the organs that are involved are the anus, the esophagus, the gallbladder, the large and small intestines, the liver, the oral cavity, and then some of the accessory organs that help with the digestive system are the pancreas, the pharynx, the salivary glands, as well as the stomach, and the vermiform appendix. The vermiform appendix, or otherwise known as the appendix, is actually a little worm-like appendage or pouch that is attached to the cecum. The cecum is actually part of the large intestine. It is actually in the very beginning part of the ascending colon. The appendix actually does not help in digestion whatsoever. There's actually still a little bit of mystery in what it helps and what it aids or helps with, as well as why is it that we have it in our bodies. Appendicitis is actually the inflammation of the vermiform appendix or the appendix. It is actually very common among teenagers as well as young adults. But it can happen to everybody at any age. I would like to inform you also that the risk of complications actually increases as the person becomes older. Also, if it is not treated, it can become very dangerous. A bunch of complications can happen, which can even be life-threatening. Some of the normal symptoms that may happen with appendicitis are pain and swelling in the abdominal region, as well as constipation, gastralgia, epigastric pain, or periumbilical pain can happen. Gastralgia is stomach pain. Epigastric is pain above the stomach, and periumbilical pain is pain around the belly button. NNV can happen, as well as hyperemesis. NNV is nausea and vomiting, and hyperemesis is actually excess vomiting. Regurgitation is the return of liquids and solid, which can happen. Pyrexia is actually fever. Tremors can happen. Tremors, from what I have done research on, only happen when the appendix is actually inflamed with bacteria. Anorexia is the loss of appetite, which you can have, and then tenderness in the RLQ or in the RUQ. RLQ is the right lower quadrant of the abdominal region, and RUQ is the right upper quadrant in the abdominal region. Some of the complications that can happen if appendicitis is not treated is rupture of the appendix, which is when the appendix bursts. Peritonitis can happen, which is the inflammation of the. Oh, give me one second. I'm sorry about this, guys. It is the inflammation of the abdominal cavity lining or walls, which will be infected with bacteria or any of the excess substance that was inside of the appendix. And then abscess. Abscess would be the, give me 1 second, so sorry about this, guys. It would be the swelling region that is filled with pus. And these are some of the symptoms that may happen. Not all of them can happen at the same time. From my own experience, I've actually had a few of these, but not all of them. The etiology or the causes is actually the blockage that is caused by a bacteria, a fecalith, growth, leukocytes, or parasites. A fecalith is actually feces or stool that is causing blockage of the opening of the appendix, and then leukocytes are actually white blood cells. If we take a look at the X-ray that I have provided for you guys, the picture, we see that there is an arrow pointing to what seems like a pebble. That may actually be a fecalith that is probably causing the obstruction and is making the appendix inflame with bacteria, probably regular bacteria or E. coli, that is causing the inflammation of the appendix. In order to receive a proper diagnosis, a few steps need to be taken, which is palpations. So palpations is the use of hands and fingers in order to feel around for any abnormalities as well as tenderness, and in order to localize where the pain is coming from within the patient. Blood tests as well as a urine analysis will be taken in order to see if there are any factors that indicate that there is an infection within the body. A pelvic ultrasonography is actually an ultrasound. This is the use of sound waves in order to make images in order to see if there's anything wrong. An MRI is an imaging machine that will take in a way pictures and actually create images in order to see the organs. The images will actually be horizontal, so you can actually see the inside and the a bit of the lining of the organ. And a BE is actually a barium enema. It is the x-rays of the lower gastrointestinal. And it was actually the previous picture that I was mentioning to you about. That was an x-ray. That was a BE. All of these are good from my own experience. The pelvic ultrasonography as well as the MRI did not work in concluding that I had appendicitis. This was due, from what my doctors have told me, the surgeon, was that my appendix, it was so inflamed that it actually almost blended in like it was part of the large intestine. So they didn't know that that's what it was. However, I'm thankful that the BE actually showed something was blocking something. They didn't know at this time, but they know that there was a fecalith actually blocking something in that region, and thankfully, thanks to that, they were able to see that I actually did in fact have appendicitis, and they found this out once I had my surgery. I just wanted to tell you guys that little story because out of all the things, I happened to see that the x-ray might work better than the two other tests because they almost came up inconclusive. They didn't know what was going on. They just thought, it was part of the large intestine. If x-ray wasn't taken, it probably could have been more severe than it actually was. For appendicitis, there can actually be only 2 treatments. Only in the very early stages can the hospital provide you with antibiotics. So the antibiotics, what they would do is they would decrease the inflammation of the appendix and will cause whatever is blocking the appendix to break down, to remove itself. However, if symptoms become worse or if they continue, you will receive an appendectomy, which is the surgical removal of the appendix. And this can be done by 2 methods. It can be done by laparoscopy, or it can be done by another method, which is a more invasive method. So in laparoscopy, it is the surgical opening of the abdomen through incisions. You would actually receive 3 incisions from this type of surgery or method. And 3 of the incisions will be made, one of them will be made in the belly button, the other one will be made in the pubic region, and the other one will be made in the left lower quadrant of the abdominal region. And then in the incision that is in the belly button, they will put a laparoscope. So a laparoscope, it is a cable that has a camera attached to the very end of it, and this will help the surgeon view what is going on the inside of your body, as well as to, if they want to, inspect other organs to make sure that nothing is damaged. On the other 2 incisions, they will insert 2 rod-like rods with clamps at the bottom in order to help grab organs or grab tools and do whatever they have to do. So the process with this one, what they will do is these clamps will have some sort of tool that has like staples, and they will staple the area that is attached from the cecum to the appendix. They will clamp these areas, and they would tie what I assume would be sort of a surgical thread in order to stop the blood flow of the appendix. They would also use another tool in which they would cut the blood flow and the blood supply of the appendix, and they will burn off the blood vessels, blood capillaries, as a matter of fact, in order to stop the blood flow and in order for you to stop bleeding. Once this is all done, they will go ahead and cut the area that is between the cecum and the appendix, and through the incisions, the appendix will be removed. So that is the most I don't want to say easiest method, but as in recovery terms, it is better for the person. The other method would be a more invasive procedure. So in this procedure, you will get a pretty big scar. I would probably say 3 to maybe 4 inches. They will open you up. They will actually make a pretty big incision on top of where the appendix sits. They will open it, and then they will use the tools in order to do what they have to do in order to remove your appendix. With that one, from some research, it has been said that it is very tough and rough on the person in terms of their recovery, while if it's done by a laparoscope, it will be a bit easier. I actually had that method performed on me, and within a week that it happened, that my surgery took place, within a week I was back in school, I was back working. I actually stopped taking medications within 6 days because I didn't need them anymore. It was not bad of a procedure. I did have a bit of a hard time walking within the first from the moment I had my surgery till maybe the 5th day, while I can only imagine if it would have been done the other procedure, it would have been a longer period of me of recovering. Also, if the appendix were to rupture, the other method is what would be taking place, because it would be more of an emergency to take it and clean that entire area out. So if very early stages, they'll give you antibiotics. If it's a normal, acute, or not that much of a severe, but a very acute appendicitis, the appendectomy will be done by laparoscopy. And if it ruptures, you'll get an appendectomy, but it'll be a more invasive and a more tougher process, not only for the surgeons, but also for you to recover. I would like to thank all of these websites in order for providing me with the information that I needed to educate you guys with appendicitis. I would like to thank the Mayo Clinic, the U.S. National Library of Medicine, as well as the National Institute of Diabetics and Digestive and Kidney Diseases, as well as Virginia College, and some of these websites that have provided me with articles about symptoms, diagnosis, as well as procedures to be taken. I hope you guys enjoyed this video about appendicitis, and I hope you guys have a Merry Christmas, and thank you very much for listening to my presentation.